I think for the for-profits, you can go on the decks of their investor presentations, you get a lot. Like, I think the for-profit hospitals, everybody should look at those, not just for those hospitals, but for the language and the terminology. That's what most hospitals are kind of talking about in their boardroom. So I think you can learn the language, and that's a study guide, right? If you could, oh, wait a minute, what's social determinants of health? That's interesting. Or, oh, wow, they're talking about growth strategies in different states. Like, or, oh, wait a minute, they're putting standalone ERs as a strategy to bring in patients. Like, you're going to learn a lot from those investor decks that other hospitals, are doing. So I think it's great education. Welcome to Selling to Healthcare. I'm Lisa Miller, and over 5 episodes, I'll be sharing insights from my 30-year career in healthcare sales. From building lasting partnerships to driving real results, I'll show you how putting service first can transform your approach. Whether you're new to the field or a seasoned pro, let's dive in and explore strategies that really work in this dynamic industry. Hi, this is Lisa Miller, and this is episode 2, Selling Margin and Mission. So, Lisa, let's jump right in and continue the series.
Yeah, absolutely. Good to be here with you again, continuing this conversation. For those of you listening, if you didn't listen to episode 1 and you want to learn a little bit more of a broad topic around selling to healthcare and a little bit more about Lisa and I would encourage you to go back and start there. All right, Lisa, let's start by you explaining what you mean by selling margin and mission and why it is crucial in healthcare sales.
Yes. So healthcare is unique, right? We're not in the oil business. We're not in the banking business. We're in the business of providing exceptional patient care. We're in the business of either life-saving services to patients, helping get them through a period of time, getting them in a healthier state, helping their families. That, to me, should be on everyone's mind, regardless of what we're selling into healthcare. So literally, like, you could be selling office supplies or furniture. Like, the business of healthcare is so unique. I think that has to be on the forefront, and how we sell, how we approach, what we want to accomplish, and a true understanding. Hopefully everything we're doing is going to impact the patient or help providers impact for positively patient care. And so, the other side to that margin side is also understanding that so many hospitals, greater than 50%, if not more, are operating on a negative operating margin. Now, that doesn't mean that they haven't supplemented their income through, investments or through fundraising. There's other ways that they can increase their income, but operating margin, meaning that their operations don't create a positive cash flow, or, they're not, in a positive situation, they're in a negative situation from their operation. So they got to supplement that, or there's going to be some other decisions that they haven't made. And we are seeing that with closing a hospital. So the idea of mission being patient-centric, the idea of margin, we're selling to hospitals that are operating on very thin margins and a lot of times negative margins. So that has to be in the forefront of our minds in everything we do. That's what I mean in how my context of mission and margin.
So can you share with us how salespeople can effectively align their strategies with a hospital's dual focus on patient care and financial sustainability?
Yes, I think it actually starts with, work you've got to do in your business before you can, kind of sell and offer your services. And I think one of the things that's really important is, as a team or as a person, as a founder, executive, write out ways that you impact patient care. Like, you need to write them out. And that may seem like, okay, well, that's interesting. And I think the reason why it's so important, you may be surprised at how many ways your solution, product, or service does impact patient care. It doesn't need to be like, you need to list those all on your website, but I think it's important, an internal strategy you need to do. And the same is write out ways that your solution impacts the finances. And I think the greater you can make that list or really be thoughtful, you could see those connections. And so that may just be only useful for you to have as cliff notes as you're having conversations. It may not, again, it may not be on your website or in your marketing materials, but I don't think we do enough thinking about that, right? How you impact patient care and how you impact the finances, and have that as a useful internal, strategy and an internal work you can do in your business. And I think it's very important that when you're presenting, you need to lead with patient care, or how do you help the people, the hospital, with their efficiencies so they can spend more time on patient care. And then also lead with, as a balance, the finances. So how are you going to help finances? So that could mean increasing their revenue. How do you increase their market share? How do you reduce costs? How do you improve efficiencies? How do you become more innovative? There's just so many ways that you need to show your value in the context of finances. So finances could be a marketing strategy, really. Like, a provider wants to come in and help with direct mail to get a specific service line out into the marketplace, like orthopedics, which is really profitable. So they want to send direct mail. It should be educational, should have a QR code, all these things. Again, hospitals can use education-based marketing too for their outreach, but virtually just about everything needs to have a lens of how are you improving the condition of the hospital. And I don't think that always happens. It could be anything. And I think that's an activity companies and salespeople need to do internally. Some of that does need to come out in their presentations, but by doing those exercises constantly or having that in the forefront, it's going to make a different impact. Plus, the other side to it is people know when you're passionate and authentic about what you sell, what you believe in. Is it transactional? Is it because you're going to make a lot of money? And those things are fine. Like, but I will tell you, when you're real and authentic and you care and you put yourself in the shoes of your prospects, your clients, and the patients, and all of us are members of this, being cared for by a hospital. And so we can put ourselves as a patient and as a family member. I think it makes a difference.
Yeah, it's almost like you have to think about it as you have two customers. One is the patient and one is the hospital.
Mhm.
Right? How are you helping the organization and how are you helping the patient? And if you really do that work and understand those two things, then you will be better equipped than most people, because most people won't spend the time to do the work and understand it.
No, and I see that a lot, as we get into other questions, and it may have some overlap, like we're selling a thing, we're selling a solution, and we don't realize that this is an incredibly different industry, enormous industry, but we're talking about the lives of people. And I think if you can make that connection in an authentic way and serve, I think that becomes this intangible skill,
Mhm.
and it's a winning skill if you're doing it from your heart, and I think it's important. So next question.
You mentioned that hospitals balance their care mission with funding through margin. How can salespeople help hospitals achieve this balance?
Yeah. And this is like interesting because if we can think about, let's say, charity care as a problem, right, that hospitals face. Hospitals face so many problems because they have to provide care and they have to wait for their funding, their reimbursement, and they have so much talk about balance. Goodness, they have so much to balance. So if we can just remember, not every solution can do it, but if there's ways that we can see where they're struggling with their charity care, and we can provide our solution to, or as an overarching solution, but then in a micro way, help them solve that problem, I think you have a win. So what do I mean by that? So, companies that sell, let's say, implants into the hospital, they can provide some of their implants at no charge if the hospital is providing that care at no charge, right? That's a wonderful illustrative example because they're getting all this business, and then the hospital has to provide some of that at no charge, and now they can say, we can help you with that, right? And there's just so many more examples of that. Maybe as a service, you're coming in and providing all these solutions for environmental services, and then you want to add in some no charge services to help with identifying patients that have certain kind of condition because that offers extra reimbursement to the hospital. I mean, there's all these different creative ways that if you know they struggle in an area, maybe you could offer some of your service at no charge or some kind of other benefit to help them, right? We're going to see an increase in more charity care that hospitals have to provide. What can you do that adds to that solution for them? A lot of care now we're trying to push in-home care. Is it something as simple as here's our solution we're selling, and you know what? We're offering hospitals a way to make calls to those patients after, and we offer that no charge. And I think we just have to be very aware of what hospitals are struggling with and not have to sell them everything, right? Sell them your solution and what can you add value that helps them with their real big challenges.
Mhm. What are some practical ways that salespeople can demonstrate that they are of service to a hospital?
Yeah, I think that we're constantly looking to sell things, right? We're salespeople, we're going to sell things, and that's natural, right? I guess the best story I can illustrate this on a practical level is it was my first day at Stryker, and I went into one of the hospitals, and there's a really amazing woman who was a materials manager in the OR and very fiscally responsible. And she was tough. And I came in, and there was a big bag of Stryker products that were expired, weren't used. And really her first question was like, what are you going to do about that? I was like, basically my first week. And I said, well, I'm going to take those back and make sure you have products you can use. She literally jumped back. She couldn't believe it. Like she thought I was going to be like, hey, it's not my problem. I'm a new rep. I don't know. Like she thought I was going to, shift the blame, which I could have. Really, it wasn't my problem. I inherited the problem. But I became a solution and said, no, we're going to figure that out together, right? I'm going to make you whole. I'm going to do something for you. I didn't know what that was. I didn't know if I could do that. But I had a great boss and we figured it out. And she became one of my best customers because she knew that I was going to be a service to her, right? And then, people want to buy from people they feel like they can trust. And, that's a micro example, but I think we can be of service in all different ways, really understanding and being observant and aware. And it's different for every industry. That's why, I gave you that example, right? And then there's so many more examples, but can we look for ways that we can be helpful and not constantly trying to sell, and add a little bit of service?
But even those insights that you talked about in episode 1, sharing insights on a regular basis is a way that you can be of service to your buyers in healthcare, especially
Yeah,
if the insights that you're sharing are helpful to them.
that's a really good point. So I was coaching somebody the other day, and we constantly have this like, we sent a proposal out, and it's like, oh, I'm checking in the proposal. I'm checking in that proposal.
I'm checking in on the proposal again.
Yes. And I'm like, don't do that. Like, just everyone stop. How about you give them a study, or how about you give them some information? And so I actually found a study, and I was like, oh, this is interesting. I sent it to him, and I'm like, oh, you should read this. Well, he ended up taking the study and using it as a follow-up, which is like, oh, I thought you'd find this interesting. It was related to this company. And I think he asked in a really nice way, if there's anything he could do. And he got a reply right back. They were thank you for the information. It's great. And he answered like, oh, it's in XYZ. We're going to do XYZ. So yeah, being of service is insights, it's information, it's I thought of you. It has to be real, like really valuable. But I think we have
And
to have.
it doesn't always have to be really valuable. So I know that you have told me as your marketing advisor
Mhm.
that you really appreciate it when I reach out to you and say, I was thinking about your business and blah, blah, blah. The same is true in healthcare. The fact that you're actually thinking about ways to be of service is being of service.
You make a really good point. And I think that's why I've kind of had these great relationships in the C-suite, because I have sent emails out like, oh, I was thinking of you. And even outside of our service, like I thought of you in here. And they really appreciate that. I'm not going to come to them unless it's something of value, but it's true. Think about how awesome it is when I'll put that in with you just said. I think it's awesome when I get a text or an email and say, Lisa, I was thinking of you, and here are the couple of things. Like, what a present. Like, what a gift. And you're doing that generally, and that just builds our relationship. Yeah, I think it's a really good point. Like, frankly, I think that's very valuable
Mhm.
to me.
Yeah, I think it's valuable too. And I think it's not nonsense. Like, I'm not just, when I do it with you, I'm not just, I'm being very thoughtful about what it is that I
Yeah,
send
because
to
you want
you.
me to succeed.
Right. And so when you do that and you apply it to healthcare, if you go back to what you said about really understanding the mission, really understanding how what you do impacts patient care and how it impacts the financial side of the organization, if you really understand that stuff, then you can be thinking about them and thinking about ways to help them and sharing that. And those thoughts are free.
Yeah,
It doesn't cost you
100%.
anything to share those thoughts. So
No,
I think it's
absolutely.
it's important.
No, I love it. And I just want to mention one more thing about it. It has worked where there's been, I know a hospital is looking at doing some kind of new initiative, and it doesn't relate to me, but I have passed on information, or this is what I'm seeing my other clients do. And you're right, it's very much appreciated.
100%. Okay. Can you discuss the importance of ROI in healthcare sales? How should salespeople approach situations where the offer is good, but maybe the financial ROI seems weak?
Yes, I think this is going to be a bigger and bigger problem these days because there are more and more eyes on purchases of just about anything. And we're even kind of seeing like nurses become ROI savvy and business case savvy. And so, first of all, I think it goes back to my earlier exercise, which is writing out those things, those areas where they impact positively the patient, impact positively the providers, and then impact financially. I think you have to do that exercise. So let's say you have a weak ROI, an ROI that expands maybe longer than 2 years, 3 years. I think you're going to have to either rethink your finances, maybe your economics don't work, like sometimes it just doesn't, and that's the reality. And I think you're going to let the market's going to tell you that. But I think then you have to connect it to some other really important tangibles like time, think scores like patient satisfaction scores, readmission scores. There's other things that you're going to need to look on the metrics. And I think, and those things are real, those are not made up, but you may have to look at where else would the hospital see value. And there's a lot of value in population management. There's a lot of value in getting higher scores or doing things better so the hospitals can make more money. But I think you have to really this is where you really have to understand the ecosystem, because if the direct dollars are not precisely fantastic and they are weak, then where else can you look to strengthen your case? And there's lots of areas to look at it.
Yeah, I like that. It makes me think that, instead of trying to get your own ROI so quickly, maybe you need to defer your ROI and help the hospital get their ROI faster. It doesn't mean that you don't get your ROI too, but maybe you get yours a little bit slower than what you were hoping to, and the hospital gets theirs a little bit faster.
I think so. I think we're going to live in a world of we have to do a little more evaluation. So I'm going to go back. You made me think of something, I'm going to go back to Striker days again. They were evaluating. Like I could never walk in and just say, look, these are great. Surgical drills are awesome. And kind of like, hey, try them and put a proposal on the table and just say, look, buy them. Like there's no way that would happen. Spend weeks in a surgery setting. They can evaluate and try before they buy. And there were a number of physicians and they do surveys and before they would buy. And I feel like that's a really illustrative example of what we might need to do more of. But yeah, you make a great point. You said like we need to de-risk.
Yes, I think that's a really important word, de-risk. How do you think salespeople can effectively communicate the value of their products or services in terms of both financial impact and mission fulfillment? This may go back to some of what you talked about
Yeah.
understanding, but how do you think they can convey that or communicate that?
Yeah, absolutely. I think, we covered that a little bit before, but I think there's probably a couple of different ways. I definitely think in the presentation, you need to address it in the forefront instead of waiting like until they ask you. Like sometimes, like if you address something in the beginning and you're open and honest, then like, here's what we see. I think it makes people feel like, oh, okay, they're understanding that this is a decision that's going to require a definite ROI. So I think it needs to be done in presentations. I think it needs to be done in some more marketing materials. Like, I think we have to push that out to the forefront. And I think we also have to make our salespeople comfortable to speak about it. Sometimes they don't, and it's pushed to a follow-up conversation. I think salespeople have to really be comfortable in this, and I think that's a gap.
Can you, if you think back over the history of time that you have been selling to healthcare, can you provide an example of a successful sale that effectively balanced margin and mission considerations, keeping, confidentiality and all that stuff into consideration?
Yeah, absolutely. I mean, I feel like I'm going to do it in two different ways, right? So I can do it in a way with how I thought about Vi, and I always thought about that, our mission was really helping hospitals utilize their money in the most efficient, best way, right? So why would a hospital want to overpay, or how could we help them extract necessary costs? And so in doing that, they can have more money for their mission, right? So I love that. I did that, for 25 years. So it was awesome. So I feel like that example of saying, look, that's my mission to help you, right? I always put that mission out there. And the margin was for us that we would prove our value, right? We were performance based. So that's an easy example, right?
Can you explain what performance-based means for the listeners who might not understand?
Yeah, sure. Performance-based means that in any environment, but more for what we did at Vi, was that we wouldn't be paid until that performance was achieved. So whatever that performance may be, right? Savings, there was some kind of financial outcome. We completely de-risked it, right? So we're performance-based. So, that is not uncommon in kind of the services we provided, but it needs to be more common in an environment where that could be used. Let's say if you are going to charge, maybe your fee is lower, and then you are compensated, incentivized, whatever that may be, for that big promise, right? And so hospitals are being paid very similarly, right? So if you think about some of what Medicare is doing now, Medicare is saying, okay, we're going to give you $15,000 to care for a patient that comes in for a knee replacement. You got to figure it out. And so that's performance based. They're also performance based on readmissions. Like 30 days after a patient goes in, they can't come back in, or you're going to be penalized. Population management is a form of incentive based care. They're being put in those situations. And I think that, so, we went down a rabbit hole, performance based, but I do feel like companies can be thinking about that more and more. So I think there's a balance of that as an example. And I'll give you one more. I mean, it's not uncommon for companies to, again, I mentioned earlier, say, look, this is our fee structure, but if we outperform, we'll get a bonus, right? And so I think those are really good examples.
Can you give me some additional examples of how salespeople can educate themselves about a hospital's mission, maybe the specific mission of a hospital and their community health goals so that they can better align their offerings?
Yeah, there's a couple of ways. Everybody can go on a hospital website. I'm sure they do, but every 3 years they do like this community health plan. It's actually required by law. They have to do it. So this plan has to be on their website. They can go to that community health plan and see all of their specific 3-year goals. It's just basically also their strategic plan. So nonprofit, for profit, everybody has it. So I think that I always go there, whether or not it's completely been accurate in the fact that they've executed on all those things, but it does give you an idea of a lot of what they're thinking about, right? I think that's one. Two, there's resources, that you can pay for that kind of give you some insights, and a number of them, I'm not going to share those specifically, but there are certainly paid resources. I think for the for-profits, you can go on the decks of their investor presentations. You get a lot. Like, I think the for-profit hospitals, everybody should look at those, not just for those hospitals, but for the language and the terminology. That's what most hospitals are kind of talking about in their boardroom. So I think you can learn the language, and that's a study guide, right? If you could, oh, wait a minute, what's social determinants of health? That's interesting. Or, oh, wow, they're talking about growth strategies in different states. Like, or, oh, wait a minute, they're putting standalone ERs as a strategy to bring in patients. Like you're going to learn a lot from those investor decks that other hospitals, are doing. So I think it's great education. There's of course these periodicals and summaries. I think reading JAMA, reading deep research-based information about what you do is really important. So I think those are some ideas.
Awesome. Okay, I have two more questions for you. The next one is, what are some of the common mistakes that you see salespeople make when they're trying to sell solutions that impact margin and mission?
I think you see them two ways, right? One is that they are so mission focused, they completely forget the margin part. Like they just have, when I say mission, so I mean by that it's either patient care mission or maybe helping the people, the providers, and they've completely, they've so much thought about like how this is going to make it easier for those that work in a hospital, or how this is going to be so much better for a patient to use once they've left the hospital. They've completely not thought about margin at all. Like it's void of it, right? And then, likewise, probably to a lesser degree, is companies, that really have such a great ROI, and they just assume by having an ROI that they could sell their product, but for whatever reason, they haven't thought about how does that integrate with their systems. Other hospitals ready to make this change? I mean, so I think they got to think about it. And I think just overall poor communication. They could have a really, again, if we go back to that exercise I mentioned earlier, if they haven't thought about it, written about it, internalized it, and they're not communicating it, I think that's a problem. And I will give you one more problem: making an ROI calculator that's wrong. So what do I mean by that? Bad assumptions. Like, so if you're going to say, oh, we're going to save you an hour by not doing this, and that hour is really only 20 minutes. Or, if you miscalculate that person's hourly rate, most of the times we're not thinking about the fringe benefits to add if we're talking about time efficiency. So we got to add fringe, but sometimes we overstate. So we've overstated an ROI calculator. I think that's a really big mistake. I'd rather understate it.
Understate and overdeliver. Yeah, that's a good one. And that also comes from a lack of real understanding of the financial ways that a hospital operates.
Yeah, I would rather understate an ROI calculator in every line and have more lines.
Yeah, 100%. All right. So our next episode is going to be a big one, and it is selling to the C-suite. Can you give us a little bit of a preview as to why understanding margin and mission is crucial for the high-level conversations that you have with the C-suite?
Yeah, I'm super excited about this conversation. I feel like we're getting to one of my most favorite topics, and it is executive selling and selling to the C-suite. So two things. One is we're going to talk a lot about selling to the C-suite and how to do that and what to do and all those aspects and why it's important. But on the kind of margin mission on that C-suite level, again, they're balancing too, right? CFO, COO with nursing officer, medical officer, CNO, CMO. Of course, you have the CEO on top, but they're balancing margin and mission. So imagine that complexity. There's a lot of interesting discussions going on there, but how do you communicate to all the C-suite thinking what they're thinking? CNO is thinking, I want to make sure it's a good environment for my nurses, and patient care is foremost. The CMO is like, listen, I'm ultimately responsible for caring, these physicians caring for the patients. You can't tell me about, how to treat the patients and how to care for patients. And then you have the CFO saying, well, okay, how am I going to pay for all this? Like, we want to give you everything, but you've just asked us for 3 different machines. Which machine is the most important? And then, of course, the COO is in line, right? They're in the ops and they're trying to keep everybody, the physicians, happy, but then they have to also work with the CFO. It's a lot of balancing to do. And I don't think people understand the seriousness of their decisions and what they have to go through. I think we come in thinking, oh, well, I have a solution. And
they don't understand the pressure they're under.
The pressure is enormous of making the right decision, maybe making a different decision. And what if it goes wrong for them? they have to answer to each other now, their C-suite, the board.
Mhm.
I don't think we put ourselves in their shoes. And how do we understand that, de-risk it, and I think be okay in that process of what they need to do to make those decisions. But
Mhm.
yeah, it's one of my favorite conversations. Ultimately, they're the decision makers. Even if you've sold lower, guess what? That mid-level or director, or wherever that may, has to go up to the C-suite to get a sign off. So how do we do two things? How do we either go there first, or B, help you get there a more efficient way from where your entry point is?
Right. How do you equip the people that are going there
Correct.
better if you can't
Correct.
get there yourself? So,
Correct. That's a great way of
right.
saying it. So,
Right.
Lisa, thank you for a really awesome episode number 2 in our podcast series, which has been very much enjoyable and to getting out the word and the message. And hopefully everyone's really finding this valuable. So we'll have episode 3 on selling to the C-suite to follow. And, if anyone wants to get a hold of me or learn more, my site is lisatmiller.com. The information's in the show notes. Lisa, do you have any final words?
No, this has been fantastic. I think it's really great. I just want to remind people too that they can go to your website and download your new book that you're sending out to people too when they listen to
Oh, yeah,
this. So,
I will.
we'll make sure that the link to the book is on the page where these episodes are hosted, but you'll also be able to find it on the homepage.
Great. Thank you, Lisa. Thanks for joining me on Selling to Healthcare. I hope you've gained some valuable insights today that you can apply to your own sales strategy. Remember, in healthcare sales, service always comes first. Join me next time as we continue to explore how to create meaningful partnerships and drive change in this complex field. Until then, keep focusing on service and watch your impact grow. And you can reach me at lisatmiller.com.